According to a recent poll, more Americans are personally worried about healthcare costs than about being a victim of a terrorist attack. Over 74 million Americans were uninsured for all or part of the year 2001 to 2002. With medical costs skyrocketing, even the insured can be left financially devastated by high health costs. Today, over 45% of all personal bankruptcies are related to medical debt. Hospitals masquerading as not-for-profits are overcharging patients and using debt collection techniques that would make the most aggressive for-profit companies blush. Chris and Cheryl Hauser faced such tactics after the birth of their third son, Brian. Brian was transferred to Advocates Christ Hospital after experiencing respiratory difficulty. Covered by a limited insurance policy, the Hausers were left with a $6,000 bill. Even though they were making monthly payments, Christ Hospital sued, demanding the bill's full amount.
When we were subpoenaed to go to court, it created a huge strain on the family. I think by having bills and debt as it is a strain on a family or on a marriage. But then to be sued for your bills and have to appear in court before a judge, I think is a whole different ballgame.
In 2001, acute care hospitals in Cook County, Illinois, filed lawsuits seeking more than $30 million from former patients. Over $11 million of that amount was sought by one hospital chain, Advocate Healthcare. The county's most aggressive litigator, Advocate's 8 hospitals sued to collect unpaid debt 3 times more often than other hospitals. Many patients named in lawsuits are the working poor, who have little or no insurance when catastrophe strikes. To add insult to injury, the uninsured often face discriminatory pricing tactics. Hospitals can charge the uninsured as much as 3 times more than insurance companies for the same treatments. So those who earn the least are charged the most.
People are experiencing a bigger nightmare from their medical bills than they are from the sickness that put them in there in the first place.
Senator Barack Obama has served the Illinois State Legislature for over 7 years. He is disturbed by what he sees as unjust collection practices by area health care providers like Advocate.
The reason we provide tax breaks to non-for-profits is because we expect that they're providing a community service. Otherwise, they should be taxed like any other business enterprise. And if, in fact, these hospitals purport to function as non-for-profits, then we expect them to take the larger interests of the community and those who are less fortunate into account. And unfortunately, they're not doing that right now.
To keep up with my bills, I have to work 7 days a week, sometimes 16 hours in a day.
Rose Schaefer, a registered nurse, was working at a home health agency that did not provide health benefits when she suffered a major heart attack in October of 2000. The grandmother of 7 was sued by Advocate's South Suburban Hospital for nearly $18,000, more than double the average charge to insurance companies for the same procedure.
In a million years, nobody could have came in here and told me that the hospital treated them like that until it happened to me, you know. And I'm a healthcare worker, been working in healthcare since 1968 till today. And it was just a shock to me and very, very, very stressful.
Often hospitals neglect to tell patients about financial assistance programs, which could greatly reduce their out-of-pocket expenses. After Advocate acquired Illinois Masonic Hospital, charity care fell by more than 70%. Luis Fernandez was assaulted on the street and rushed to Illinois Masonic. Without health insurance, he was left with a nearly $12,000 bill. As an uninsured patient, Luis may have been eligible for charity care, but even after learning about his insurance status, no charity care was offered by the hospital.
Not only was I assaulted once out in the streets and almost lost my life, but I'm also being assaulted by these people making all these harassing phone calls saying they're going to take the little money that I do have. It's hard for me as a Lutheran because I know that Advocate is affiliated with the Lutheran Church.
hospitals should be a ministry of healing and not a group of bandits that rob.
For more than 6 years, Pastor Rayford Grady has ministered to Chicago's South Side. He feels hospitals should not resort to the aggressive debt collection techniques used by other industries.
I think it's wrong anywhere, but I think it's particularly wrong for the hospital, because here's a person that doesn't ask to be sick. When you go to a car dealer, you're asking for an automobile. So that's a choice. That person has no choice about being sick.
For the Hausers, the pressure tactics began with a sheriff at their door serving a summons. Called into court 4 times, Advocate tried to pressure them into putting a second mortgage on their house, threatened to garnish their wages, and push them to borrow money from their family and friends.
Advocate provided a service for us, the health of our child, and the outcome was good. I was doing everything under my power. I had 3 other medical bills that I had to pay, and I was paying them as well as all the other bills. So it was never a question of I didn't want to pay. I was paying, and then they did this to us.
The Hausers were finally able to settle out of court, paying a portion of their bill with credit cards and arranging a payment plan for the rest. For Rose Schaefer, matters only got worse. In danger of losing her house, she was forced into bankruptcy and still struggles to get out of debt.
I thought that when I got this age, I would be retired. I'd be able to spend time with my grandkids, be able to travel. I haven't been able to do any of those things. I thought these would be the easy years, you know, but they harder now than it was when I first started working.
Luis Fernandez is also struggling to get his life back on track.
And I didn't ask for that to happen to me. I didn't say, hey, come guys, come beat me up. Come take my life, which they did. Everything revolves itself around money around here. And by them billing me for money that I don't have, I didn't have at the time, I don't have it now, it doesn't make it any easier for me. If they would just work with me to where I can give them a little bit at a time, then that would be a tremendous help.
The SEIU Hospital Accountability Project, along with religious, political, and community leaders, are urging Advocate Healthcare to end its unjust policies. The call to action has yielded some positive results. Angela Lee, who paid a $7,000 hospital bill by depleting her children's education fund, was featured in a Hospital Accountability Project newsletter. Advocate returned her money with an apology and $800 in interest. Luis Martinez faced bankruptcy after Advocate refused to honor its own insurance policy, but they forgave his debt after his story appeared in the Chicago Tribune. Vincente Mendez, an immigrant cook earning $21,000 a year, had no idea how he would pay his $17,000 bill. Advocate forgave his medical debt after he spoke out at a town hall meeting. To date, nearly $250,000 in debt has been forgiven. However, this is just a drop in the bucket for an advocate system that sought $11 million through lawsuits in 2001 and continues its pattern of aggressive litigation. The call for real change is clear and unified. Religious leaders and people of faith are calling for a time of jubilee, for Advocate Healthcare to restore just relationships with its patients by ending discriminatory pricing and predatory debt collection, and by forgiving all unjust debt.
Well, I would like to think that not-for-profit hospitals would voluntarily cease these kinds of predatory practices. But if they don't, ultimately the government has to step in and protect consumers to make sure that the uninsured are not treated like criminals simply because they're sick and have inadequate insurance. And one of the things that I think many of my colleagues in Springfield are committed to is making sure that these kind of practices don't continue to happen.